Hello, I'm Dr. Jeannie Shen, Medical Director of Breast Surgery at Huntington Hospital. The American Cancer Society currently recommends that every woman starting at age 40 undergo a clinical breast exam by her doctor and a routine annual screening mammogram. In addition, a monthly self-breast exam is recommended starting at the age of 25. A monthly self-breast exam is important as a third of breast cancers are found by the patient herself, so this is a very important part of early detection. The self-breast exam should be done once a month. If you're still menstruating, ideally it's done 7 to 10 days after the start of your menses. Otherwise, just pick the same day of the month to do it every month, and this will make it easier to remember. Remember that it is important to do a monthly self-breast exam to get to know how your breasts normally look and feel, as changes can be an early sign of breast cancer. Step 1 of the exam involves just simply looking at the breast. So stand in front of the mirror with your arms at your side at your hip. Take a look at the breast. The two breasts should be more or less mirror images of each other. So you want to look to see if there's any obvious changes in the size, the shape, the contour of the breast. Look for any swelling of the breast, any dimpling or puckering of the skin, any redness of the breast. Also pay attention to the nipple. Is there any scaliness or redness of the nipple? Is there any fluid or discharge coming from the nipple? And is the nipple inverted? These can all be early signs of breast cancer, and if you notice any of these, bring it to your doctor's attention immediately. Step 2 is simply to raise your arms over your head, and you're looking for the same signs. Step 3 of the exam involves laying down. You're going to use your right hand to examine your left breast and your left hand to examine your right breast. While you're laying down, starting with the left arm up, cross the right hand over and start to examine it. You're going to want to use the middle third fingers of your hand, about the flat portion up to the pads, and you're going to exert a light, medium, and deep pressure, using small circular motions about the size of a quarter. When you're examining your breast, it's important to make sure you uncover the entire breast, and the breast goes from the collarbone all the way down to where the bra wire is, from the cleavage all the way to the armpit. While you're doing so, you want to use a consistent pattern. So think of your breast as a clock, and you'll start from 12 o'clock, from 1 o'clock towards the center, 2 o'clock towards the center, and so forth. When you've made it all the way around the clock, don't forget to go back and examine the nipple. You want to push down behind the nipple, and you'll also want to feel under your arm in the armpit for any swollen lymph nodes. Many women often feel that their breasts are very lumpy and dense, and they don't want to examine them, or they're scared to examine them. Remember that lumps in the breast can be a normal part of your glandular breast tissue and are no cause for worry. If the lumps all feel like each other and they feel like the lumps in the other breast, then they're generally normal breast tissue. What you want to pay attention to are any new lumps that develop, or lumps that may feel different from other lumps in the breast. It can be difficult to feel for lumps on the top of the breast when you're in the laying down position. So the final step of the breast exam involves changing your position to a sitting or standing position. So sit and or stand, and using the same 3 fingers, again repeat the exam on the right side, on the left side. Don't forget to push behind the nipple and in the armpit. Many women find that this last step can be easiest to do when your hand is wet or slippery, and they like to do this in the shower. This completes the self-breast exam. Report any new signs or symptoms to your doctor. Remember, 5 minutes once a month can save your life. For more information about breast cancer diagnosis and treatment, please visit www.huntingtonforher.com.